Most people think that Corona is the worst pandemic in the world. The director of the National Institute of Allergy and Infectious Diseases, Dr. Anthony Fauci, and others prominent in the field have estimated that when all is said and done, COVID-19's mortality rate will be around 1%, 10 times higher than an average for the seasonal flu. The mortality rates for past pandemics have been far higher. Middle Ages Europe's 14th century plague is estimated to have killed between 30% and 60% of the population. In this video, we are going to tell you 10 of the worst pandemics in history. But before we dive into the video, make sure to like and subscribe to the channel. Let's get started. Smallpox pandemic, 1877 to 1977. One of history's deadliest diseases, smallpox is a viral infectious disease that causes a significant skin rash and fever. The earliest evidence for the disease comes from the Egyptian. The disease later spread along trade routes in Asia, Africa, and Europe, eventually reaching the Americans in 1500s. Today, the virus only exists in 2 secure laboratory facilities in the US and Russia. Smallpox is estimated to have killed up to 300 million people in the 20th century and around 500 million people in the last 100 years of its existence. Black Death, Plague, 1347 to 1351. Bubonic plague is a type of infection caused by Yersinia pestis bacterium, which is spread mostly by fleas on rodents and other animals. The plague that caused the Black Death originated in China and spread along trade routes westwards to the Mediterranean and northern Africa. In the 14th century, Black Death infected 200 million and killed 25 million of the entire global population. Spanish flu pandemic, 1918 to 1919. Was an exceptionally deadly global influenza pandemic caused by the H1N1 influenza A virus. The earliest documented case was March 1918 in Kansas, United States, with further cases recorded in France, Germany, and United Kingdom in April. 2 years later, nearly a third of the global population, or an estimated 5 million people, had been infected and between 17 to 50 million were killed in 4 successive waves. Coronavirus pandemic 2019. COVID-19 is a type of viral respiratory infection caused by a coronavirus known as SARS-CoV-2. Cases were first reported in Wuhan in China in December 2019, and since then it has spread around the world, becoming one of the deadliest pandemics in history. As of July 2022, 560 million cases have been reported and total deaths are 6.37 million. HIV Aids pandemic 1981. The HIV Aids global pandemic persists to the present. In 2020, 37.7 million people globally had HIV. 1.5 million people acquired the disease, and it caused the deaths of 680,000 people. AIDS-related deaths have steadily dropped from the 1.9 million that died from the disease in 2005. Hong Kong flu, 1968 to 1970. It was caused by an H3N2 strain of the influenza A virus, descended from H2N2 through antigenetic shift, a genetic process in which genes from multiple subtypes are assortment to form a new virus. The first cases of the virus outbreak that year began to appear in the southwestern Chinese province of Guizhou. Flu pandemic whose outbreak in 1968 and 1969 killed an estimated 1 million people worldwide. 6th cholera pandemic, 1899 to 1923. The 6th cholera pandemic originated in India where it killed over 800,000 people. Before spreading to the Middle East, North Africa, Eastern Europe, and Russia, the 6th cholera pandemic was also the source of last American outbreak of cholera. American health authorities quickly sought to isolate the infected, and in the end, only 11 deaths occurred in the United States. By 1923, cholera cases had been cut down dramatically. Ebola virus, 2013 to 2016. Ebola, also known as Ebola virus disease, is a type of viral hemorrhagic fever caused by Ebola viruses. It was first identified in 1976 in Sudan and the Democratic Republic of the Congo at a village near the Ebola River. Since then, there have been numerous outbreaks across sub-Saharan Africa. This flu infected 30,000 and killed between 12,000 people. SARS. This pandemic involved a respiratory disease caused by a type of virus known as the Severe Acute Respiratory Syndrome Coronavirus, SARS-CoV. The virus was spread through respiratory droplets. The outbreak first started in China on 16 November 2002, and from there, it spread to 30 countries around the world. Through this virus, 10,000 of people were infected and between 2,000 of people were died. MERS-CoV. Another viral respiratory infection caused by a coronavirus is the Middle East Respiratory Syndrome. The virus responsible is known as Middle East Respiratory Syndrome-related coronavirus MERS-CoV. It also spread through contact with an infected person. While cases of MERS have been seen worldwide since the initial outbreak in 2012, by this virus as of July 2022, 2,500 cases are reported and between 1,000 people are dead. This is for today's video. Make sure to like the video and subscribe to the channel for more relevant content. Goodbye.